Good afternoon. Thank you for joining me this afternoon for this initiative that we're a part of. The initiative is the Assessment and Treatment of Acute Pain Improvement Initiative. The purpose of this initiative is we, through our patient satisfaction surveys and interviews with patients, have received a number of complaints that their pain had not been managed. So in this purpose of this initiative, is to improve the assessment and treatment of acute pain. Ineffective pain assessment and pain management cause the patient to perform poorly in therapy, and therefore they don't reach their highest level of potential. Improving both the pain assessments and the treatment of acute pain will also improve our patient outcomes with therapy and patient satisfaction. And we all know that happy patients are return patients. And we also improve our patients' quality of life overall. For this change initiative, we'll be using Kurt Lewin's change theory. Kurt Lewin said that to achieve change, driving forces must be strengthened and restraining forces must be weakened. Restraining forces in this case include values, norms, and relations among people. Driving force include the desire to change. So he used a system that was unfreezing, moving, and refreezing. In the unfreezing stage, we'll have communication. We're going to meet with all staff members to let them know what the patients and their surveys said. We'll have education to see what we're going to do as far as the pain initiative. And we'll also identify our resistive forces through these conversations and these meetings with staff. In the moving phase, we'll present ideas and we'll brainstorm for a solution. There'll be an implementation of a task force that will be of all staff members across the board. It'll be representation from therapy, from nursing, from administration, and this group will brainstorm and come up with ideas, and then we will implement new approaches following training. In the refreezing stage, we'll monitor the progress of this initiative. We'll continue to evaluate its effectiveness through more patient surveys and more patient interviews, and there'll be ongoing education. Also, we'll continue to provide staff support and retraining as necessary. The problem, which is the ineffective assessment and treatment of acute pain, as I said earlier, results in decreased patient outcomes as well as satisfaction and overall quality of life. Our facility determined through patient interviews and surveys and discussion with staff that there's a problem with acute pain assessments. What we'll do, the sample population will be those admitted to us that are greater than 21 years old, that have been admitted to inpatient rehab for either a fracture or a surgical procedure over a span of 14 days. Patients that are admitted with medical conditions such as dehydration or COPD, asthma, pneumonia, congestive heart failure, those diagnoses will be excluded because we're really looking at the treatment of acute pain. While we're doing this initiative, patients who meet that criteria will be interviewed and as well as monitored throughout their stay. And the end result, as these patients progress, their therapy progress notes will be monitored, and also we'll look at the MARs, the medication administration records, and we'll also look at the nurse's notes. The outcome, as I said earlier, is the improvement in assessment and treatment of acute pain. This improvement will in turn result in increased patient outcomes and increased patient overall satisfaction, as well as their quality of life. So I'm looking forward to getting this started. I know that other key management that I've met with are looking forward to get this started. And I just wonder if you guys have any questions today. Nobody? Okay, thank you for joining us.